Hello, everyone. Thank you, Frank, for the gracious introduction. So I'm here to talk to you about group singing and its effect on oxytocin, cortisol, oxytocin, and pain tolerance in a population with Parkinson's disease. Okay, so just a refresher. So Parkinson's disease is a neurodegenerative disorder that causes motor deficits, including rigidity and tremors. Pain is a common problem for people with PD, and the thinking is that this might arise from their dopamine deficit. Some PD patients do find temporary relief from pain through group singing, which has also been shown to mitigate voice challenges related to PD. I believe that was a study by Arla and Frank. So past work has shown that music-related activities, not just singing, they do upregulate neurohormones that are responsible for the analgesic response. So things like dopamine, opioids, and oxytocin. And they also downregulate hormones involved in the stress response, such as cortisol and beta amylase. But there has no work that's been done that really specifies a neurochemical mechanism action on pain tolerance or pain threshold. So here we want to examine whether group singing's effects on cortisol and oxytocin, whether they contribute to any pain relief that is experienced with PD patients. So we've collected so far data from 14 participants with Parkinson's disease, and these were recruited from the UTunes Choir, which is a singing group for people with PD. There were 4 females. The mean age of the participants was 73.8 years. We excluded people at risk for mild cognitive impairment, which had a Montreal Cognitive Score of more than 21. In terms of experimental procedure, choir members participated in a 12-week singing program involving weekly 45-minute sessions with a certified music therapist. Salivary samples and pain threshold were collected before and after the first session, the second session. The 7th session was just session 2, and the last week, which was session 3. We conducted 2 mixed linear model analyses. So in the mixed linear model, the dependent variable was pain tolerance or pain threshold, and the dependent variable was either cortisol or oxytocin. So we did find that the decreases in cortisol were significantly contributed to increases in pain tolerance. And so that finding was significant. We did not find any significant contributions of oxytocin to pain tolerance. So we couldn't find any results for oxytocin in that regard per se. In terms of just looking at pain tolerance itself, this is a graph showing the pain tolerance, which we measured by dolorimeter, which is mean pounds tolerated. And we have pre-session and post-session. So overall, we do see an increasing trend. So pain tolerance increases from pre-session to post-session overall for sessions 1, 2, and 3. And this turns significant in session 2. So we do have some significance in that regard. And for cortisol, we see a general trend of a decrease pre-session to post-session, and that turns significant in session 3. In terms of oxytocin, we don't see any significant findings. Keep in mind this is a small sample size. And there are some reasons that we hypothesize why we don't see that in this particular population, which I'll go into later on. So just to recap, pain tolerance significantly increases after session 2 and does show a general trend of increasing after each session. This does validate previous work, which shows that performance of music increases pain threshold. Cortisol significantly decreased after session 3 and significantly contributes to increases in pain tolerance, as we found in the mixed linear model. Elevated cortisol does activate the sympathetic nervous system and stress response, and past work has shown that singing reliably does reduce cortisol. So this validates the previous work in that regard. we didn't see any significant increases in oxytocin after the singing sessions. And we think the reason behind this is that the medications that people with Parkinson's disease take, which are largely dopamine agonists, they would interfere with opioid signaling and also and therefore downstream oxytocin signaling. So if they're on these medications for a prolonged period of time, their tolerance, their sensitivity to any increases in oxytocin, dopamine, or opioids that they would get from group singing would be theoretically less than those in a healthy population. So that's why we think that, so that's one of the reasons why we think we're seeing what we're seeing is that the pain threshold increases that we see in PD patients are largely through the sympathetic nervous system stress response pathway, as opposed to the central nervous system pathway, which consists of dopamine, opioids, and oxytocin. And I would like to just conclude that I think SingWell is in the process of collecting more data, and which would allow us to have a much higher sample size, increased statistical power to verify these results. And we do hope to extend these results for other key neurohormones such as beta endorphins. And also we would eventually like to include an equivalent size healthy control group so we can run some sort of randomized control trial. And I would be happy to take any questions at this point. And thank you for your attention. Yeah.
I have a trivial question, really trivial. It's how do you recruit them? I mean, my feeling that, and it's true for most of the studies, is that they are volunteers. So it's not any Parkinson's disease patient who will go to attend your activities.
Yeah.
And can you comment on that?
I wasn't involved in the recruitment.
I'll comment on it. Yeah, you're exactly right. It was they were recruited through the UTunes, which was housed at U-Turn Parkinson's. It's an organization that supports healthy living for people living with Parkinson's. So these are people who are really well connected in their community. They box, they run, they have conversation groups, and now they sing. So it is something that we note and are trying to address and this is where social prescribing is going to be really beneficial, because we're going to be getting people who aren't connected to anyone. They're going to a doctor because they're lonely. They don't know where else to turn. And then they're going to be recruited to our studies. So.
Yeah. No.
Yeah, it's a huge problem.
It is.
In a lot of areas. Maybe aphasia is the strongest one. The people who engage in the aphasia studies are really exceptional.
Mm-hmm.
In some of these other disorders, like Parkinson's is maybe in the middle, breathing disorders, maybe there's even more access to these services. I don't know if I'm being clear, but there are certain communication deficits where people want to stay at home. They don't want to go out.
And also, I'm not sure that so many people want to participate to choirs compared to other activities. It's always the same kind of question when it is randomization with other activities. Would we see the same effect?
How did you test the pain threshold? Were you asking them ahead of time what was their pain, and then afterwards has it gone down, or were you was it the shock, feel pain?
It was the pressure test with the dolorometer. So there are some demand characteristics that ideally we should have probably corrected for, but I think we can in future studies with like a demand expectancy questionnaire of some kind. But I don't think it would, I mean, the finding I think is strong enough to overcome that. And that, yeah, I'm not sure. It's
Yeah. I mean, we could have a side discussion, but yeah, but maybe we don't have time today. But But the measure that we're using a little bit out of convenience because it can be administered relatively quickly. It's not a gold standard pain measurement technique. And some of us in the room have concerns about the lack of consistency in how it's administered and what we call demand characteristics, or the participant wanting to look tough for us after they've sung. But I'm not dismissing the measure altogether personally. Some other people in the room are. That's where we're at. That's where it's. Sorry, yeah.
There are control groups that we
Right.
that those same demand characteristics with individual singing, for example. So we brought, I mean, it was a different design than what Dawn did, but we brought people into the lab and had them sing in the lab, and we tested before and after that singing as well. And we didn't see any change in pain thresholds in that context. Not convinced.
Yeah. Sometimes when you have a strong enough effect, it can tolerate noisy measures, but it's not the best measure. Sorry? Yeah. We're having this.
No, we can have a workshop on that topic. Remember, we discussed that, but I discussed this point with Mathieu Roy, who has a CRC, Canadian chair, research chair on this topic, and there is none actually. That you not a single measure except the thermode, but which is extremely expensive and hard to administer.